September is Gynaecological Cancer Awareness Month, and it is used as an opportunity to encourage women to become more aware about cancers of the cervix, vagina, vulva, ovaries and uterus, including early detection and prevention. Now let's discuss this further. I'm joined by Dr. Vuyokazi Gqola, who is an executive of healthcare management at GEMS. Doctor, thank you so much for joining us this afternoon. Now, there are various types of gynecological cancers, and it's vital for women to be educated, screened, as well as vaccinated. But why do we still find that women are reluctant to take up that opportunity?
Thank you, Gqola, for having me on the show. It is true that as far as preventative and screening benefits are concerned, there is this reluctance for women to actually go and have the test done, whether they be utilizing the public or the private sector. And I think with COVID, what we saw generally was that there was this decrease in health-seeking behavior because people really didn't want to go near healthcare facilities. And what we did find was that there was a significant decrease in the uptake of utilization of screening benefits as well as preventative benefits. And I think with the COVID pandemic, really, it was understandable because, of the lockdown restrictions, as well as just lack of access to care and people trying to avoid hospitals, especially as far as COVID is concerned. But generally, even without COVID now, the country has opened up again. We still find that a lot of the screening benefits are not being utilized as they should be. And it could be due to lack of awareness. It could be that, people always feel that they need to get tests done when they are healthy and only really actively go and seek medical help when they are ill. So we really need to push the message that it's very important to have regular checkups and make use of those benefits that you have if you are a private patient to make sure you get screened.
Most certainly. Now, is there a prevalence of South African women having more cancers as opposed to other women across the globe? If so, why is that the case?
So with the HIV pandemic that we've had in the country, as much as we've got really good HIV programs in the state sector as well as in the private sector, we have found that because of the higher incidence in HIV, for example, cancers like cervical cancers are more common because of the HPV vaccine. The HPV virus, which is why the state then rolled out this the HPV vaccine for teenagers in order to prevent this. It's very important then to have regular pap smears, for example. So the incidence is higher among women, especially because of the incidence of HIV in South Africa, which is the most common, actually, cervical cancer being the most common.
Now, Doctor, every time we speak of cancers, early detection is one thing that certainly comes up quite the most. We know with breast cancer, one through self-examination, if you find a lump in your breast, that could be the first sign for you to see a doctor. In the cases of gynecological cancers, what would you say are the first telltale signs that one needs to be aware of and then seek medical attention?
The problem really with gynecological cancers is that by the time that they are detected, if the regular screening is not done, the cancer may have advanced or may have even spread. So what's really important is to make sure that you are very much aware of your menstrual cycle. You're very much aware of the types of, for example, if you're if you are a woman of childbearing age, you must know your cycles and you must know if there's a discharge, for example, that is abnormal, which you would be familiar with the different discharges within your menstrual cycle. When you do feel that there is a discharge that has an odor that is not a good one, then there is a sign that something is wrong. It could be an infection, but it could also be cancer, for example. What's important, though, I think, is to have regular checkups with your gynecologist, because that is the way where if there's anything that the gynecologist is suspecting, then they can go further and make sure that they do the necessary tests for you. So it's just very important to, I would recommend that women go to regular gynecologist visits just to make sure that they get checked properly. And of course, have annual pap smears. In the state sector, it's every 3 to 5 years, but in the private sector, a lot of medical aids actually do allow you to have a pap smear on an annual basis, every 2 years.
Speaking of that frequency, doctor, as well as the accessibility to gynecologists, are we making strides, especially for women in remote and rural areas, to have access to such?
You know, there are very good organizations out there, non-governmental organizations, that really try and create access to women with regards to screening services for pap smears, cervical cancer, as well as breast cancer. I do think that we know that we've got a huge problem in South Africa with access, especially in rural areas, where women don't really have as much access as those of us that live in the urban areas do. So access is usually a problem, and especially people with lower economic status, and people that don't have access to or do not have medical aid, it might be a problem, because clinics, we know that are usually the staff is overworked and the queues are long, so people tend to avoid going to clinics. But in the primary healthcare system, even in the state sector, people can get access to services such as those. But I think there is a need for more or creation of more access, especially in the remote and rural areas. And there's really a lot of wonderful organizations that are trying to really bridge that gap.
Lastly, doctor, what are some of the myths associated with gynecological cancers?
Well, I think, cancers can be cured. Cancers can be managed, and people can be in remission if cancer is detected early. So, getting a cancer diagnosis is not necessarily a death sentence. I think what's important is that we need to remember that we don't only go to the doctor when we're sick. We always seek medical help on a regular basis to make sure that even if there is an occurrence of cancer, it's detected quite early so that it can be treated. So I think one of the myths is that, it's as soon as you get that diagnosis, it is a death sentence, which it isn't. It's important for us to really push people to get more screened, and hopefully women get this message that they need to go and sought treatment as soon as possible, because there are very good treatment modalities out there to treat cancers when they do occur.
All right, thank you so much for your time and for those insights. That's Dr. Vuyokazi Gqola, who is a health care management executive at GEMS. Now, going back to